They can decide, okay, we'll get married, but we're not going to have any children of our own, so we're going to adopt.
I don't know why people see adoption as. For me, I don't see anything.
It's fine.
I don't see anything.
It's
wrong
an
with
option.
adoption.
If you must
Yes.
have kids, you can adopt. Now, what happens in most O-negative women is during the first pregnancy, if the man, take note, if the man is positive during the first pregnancy, positive and negative, when it comes to the body now, like poles would attract, unlike poles will repel. So positive, negative, they will not attract, so they will repel. And when that happens, first pregnancy, the woman's body gets sensitized and she'll be like, okay, I don't know, this is a foreign object, but I cannot fight it, so I'm going to develop my own army that is going to fight. So by subsequent pregnancies, she has enough, she must have formed enough armies to fight. So any pregnancy will be seen, any fetus will be seen as a foreign body that wants to attack her, and her body fights against it. And now series of miscarriages. When you ask the child, how old are you? You'll be looking 9, whilst the child will be like 18, 19. That's how it is, because we are not growing.
Welcome guys to another episode of the Bliss Hour. My name is Bliss. Before we begin, we would like to thank you guys, our viewers, for supporting us on our previous videos. It has motivated us to come up with more amazing and interesting videos for you all to watch. With us here, we have two guests. They are going to be talking to us about knowing your blood group and genotype. And yeah, that's the topic. Before we unveil our guests, we'll go for a short break. Sit tight and don't go anywhere. We'll be right back. Like I said, we have two guests that will be talking to us about knowing your blood group and genotype. Please do us the honor of introducing yourself. From the lady, please.
My name is Dr. BEVERLY.
I am Dr. Emmanuel Gifts IMABIN.
Okay, Dr. Beverly and Dr. Gift IMABIN, you're welcome to today's show. So, like I said, our topic for today is on knowing your blood group and genotype. First of all, we've been hearing about blood group. So, what exactly is blood group, Miss Beverly?
Basically, blood group is a system. The blood grouping system is a system where different blood types are classified or categorized for ease of identification and also for ease of matching when it comes to transfusion, as well as some other necessary procedures. And the importance cannot be overemphasized. There are different blood groups that exist. We have the ABO classification system, we have the Duffy, we have KEL, we also have the resource. That's the one that tells you positive or negative. And these classifications are important. The very common ones amongst humans. You have the ABO classification and then the resource classification. And just as we have, when you ask someone what's your blood group, they tell you my blood group is A, my blood group is O, I'm AB. And then when the resource factor, the RH factor comes in, you now hear them say things like positive, negative. So that's basically what blood group is about. And it's dependent on the presence of certain substances called antigens in the red blood cells.
Thank you so much for that. So, over to you, Mr. Gift IMABIN. What's the difference between blood group and genotype?
Okay, just like she said, blood grouping has to do with classifying the various blood types into different categories based on the presence of, like, the most popularly used classification, the ABO, based on the presence of substances we call antigens. And so these substances are found in the red blood cells in the blood, we all know. Then we have the alpha, the beta, that you classify them into blood group A, B, AB, or O. O just simply tells you 0, nothing, means there is no antigen. in the blood. But genotyping now has to do with the genetic makeup of the some of the contents like the hemoglobin. It is mainly hemoglobin genotype. That's what they call it. Or people call it genotype means genetic makeup. But when we talk about blood genotype, it is hemoglobin genotype we are referring to. You understand? It's hemoglobin genotype. It is different from blood grouping. Blood grouping just has to do with the presence of the type of antigens in the red blood cells, on the surface of the red blood cells. While genotype has to do with the genetic makeup of the um, hemoglobin. Hemoglobin is a substance contained in the red blood cells, and that's not where you now have the hemoglobin A, hemoglobin S, hemoglobin C, D, M. There are different types, and then they are usually together. Like you have AS, SC, SS. You understand? Based on the inheritance pattern. So each individual has a pair of the genotype, and they are inherited from your parents. So you inherit a pair from your both parents. So you are either inheriting A, or you're inheriting A and S, or you're inheriting S and S, or S and C, based on the genotype of your parents.
So all this
Mhm.
boils down to parents.
Yes. Even the blood grouping too.
Mhm.
Yes.
Thank you very much. So, Miss Beverly, we've talked about the. So, Miss Beverly, you've told us about what blood group exactly is, and you have also told us about genotype and blood group. So, how can I know my blood group and genotype? How can the viewers also know their blood group and genotype?
I'm tempted to say go and ask God, but then this is a scientific discussion. So it's not written on the foreheads of anybody. You don't just discover out of the blues. You have to get tested. It requires you to go to um, a laboratory, a scientific laboratory. They will take your blood and then it will go through some processes and they would identify which class you belong to, your blood group, your genotype. That's in simple terms how you can know. It's not written on the forehead. You cannot even tell exactly based on your parents' blood group or genotype what yours would be because these things are not so easy, as I'll put it. If my dad is blood group A and my mom is B, it doesn't exactly mean that, oh, okay, I'm going to become AB. No, that's not how it works. Yeah.
Thank you very much. So, Mr. Gift Imagine, she has told us about the classifications of blood group. So, I want you to throw more light on them. Like, tell us a more detailed information about blood group. Give us a more classification of it and what they bring together with them.
Okay, the different blood groups. You have antigen A, which um, makes someone have blood group A. Antigen B makes you have blood group B. Then if you have the both of them, you have blood group AB. And when you have none of them, blood group O. O now means nothing. You have 0. So if you have antigen A or antigen B or the both of them, the body automatically will have antibody against the corresponding antigen. So if you have antigen A, the body will have antibody B. So that the antibody will not be against your own antigen. So if I have antigen A, I'm not going to have antibody B. Because those antibodies, like it sounds, antibodies, they fight against, in layman terms, the antigens. So it's the body's defense system. They fight against foreign bodies. So they are not going to fight against itself. If you have antigen A, your body will not have antibody A. They rather have antibody B. And that is why you can have blood group B taken when you are having antigen A. So that's how it works. Then for the O, For the O, they do not have any of the antigens. So it means they have the antibody A, antibody B. So if you give them A, the body fights against it. You give them B, the body also fights against it. But the AB has none of these antibodies. Oh, it's clear enough.
Let's get a little bit specific. This question is for you, Miss Beverly.
Okay.
What's the connection or what role does blood group and genotype play in a relationship?
Okay, in a relationship, blood group and genotype, I believe, plays very important roles in their own area in a relationship. It just depends on the type of relationship. Take, for example, a familial relationship, mother and child, father and child. If their blood types or their blood groups are not compatible, the mother can't or may not be able to donate blood to her child who is in need. And that's a very important aspect of the father. And that's where you now see people questioning if the child is actually theirs of this discussion, anyways. But that's one very important aspect when it comes to familiar relationship. And then when you go further to talk about marital relationships, when you have a relationship where both individuals are AS or one is AS and the other is SS, you don't want to bring these two individuals together because there's a high chance or a 25% chance of having a child that would be SS, that's having the sickle genes. And the presence of both sickle genes is not a good one. Just like I earlier mentioned, the red blood cells will not get to maturity, they keep dying early, and they are sickle in shape, and that causes a lot of problems for the child. Now, another important thing we need to note about this is that it's sickle cell anemia or sickle cell disease is a condition that is transferred, is recessive in its mode of transmission, so put to the child. So that the mother is A and S and the father is A and S does not mean that every child will be S and S. So it follows the Mendelian inheritance pattern, and A would go A and A, you have A and S, you have S and S as well. And when you have a child that is SS, that child will be termed to be living with sickle cell anemia. It comes with a lot of burden to the parents. It comes with a lot of financial burden, emotional burden, physical, social, for the parents. For the child, it's not even any easier. They're out of school most of the time, they're in and out of the hospital, they are unable to grow both socially, academically, physically with their mates. You see them looking much younger, or they are looking so small. If you've actually seen a child with sickle cell anemia, it's not a beautiful sight to behold. I can tell you for sure. They are when you ask the child, "How old are you?" The child will be looking 9, whilst the child will be like 18, 19. That's how it is because they are not growing. The oxygen that the body needs, the hemoglobin, is not even there to move it around. So cells in the body are dying off. The child is dying literally. They are going in and out of the hospital. They cannot do what their mates would do. Not everything their mates would do, they can do freely. They are so careful about everything they do, their environment, their feeding. You can imagine living that kind of life. So it's the burden is so much both on the parents, the child, and as well the society at large. So that's why we usually advise that it's important for individuals who are getting serious in marital relationships to ensure they know their genotype. Whilst for the blood group, it's more important for the females to know their rhesus factor, their RH factor. And that's because there's something that occurs in women with the negative factor. Now, what happens in most O negative women is during the first pregnancy, if the man, take note, if the man is positive during the first pregnancy, positive and negative, when it comes to the body now, like poles would attract, unlike poles will repel. So positive, negative, they will not attract, so they will repel. And when that happens, first pregnancy, the woman's body gets sensitized and she'll be like, okay, I don't know, this is a foreign object, but I cannot fight it. So I'm going to develop my own army that is going to fight. So by subsequent pregnancies, she has enough, she must have formed enough armies to fight. So any pregnancy will be seen, any fetus will be seen as a foreign body that wants to attack her, and her body fights against it. And there are now series of miscarriages. However, this can be prevented once you know that you're negative. You during the first pregnancy, there are certain drugs that will be given to you if you that's why there's the importance of antenatal care. Now when these drugs are given, it stops that reaction that occurs, and it will stop her body from forming that army to fight against subsequent pregnancies. So she's fine, she can have children. But if that is not done, you would see that she would keep having series of miscarriages, and then they will not say village people have come. In this part of the world, everything is village people, but we with poor knowledge we would always blame village people and obanje. But with good knowledge, enlightenment, we'll get to understand that it's not village people anything. It's actually something happening in our body. Our body is seeing these things as foreign, and that's how beautiful the human body is, how God created it. Anything foreign, it pushes it away so that it doesn't destroy you.
Okay. So I heard you talking about rhesus factor. What are rhesus factor?
Okay, so I'll try to break it down as much as possible. When we talk about the rhesus factor, it's the rhesus is also a type of blood grouping system, or RH. Now, it classifies one as having or not having that specific antigen. So you can either be positive or your RH negative. So when we go for blood typing or blood group test, they'll tell you you are blood group O positive, blood group O negative. So that's positive or the negative there is the rhesus, the RH factor. Now, this RH is important when it comes to still matching compatibility testing, because like poles will always attract themselves, unlike poles will repel. The like one sees the unlike one as a foreign body and would always fight against it. You understand? So positive are friends, negative positive are enemies.
Okay. Thank you very much. Mr. Gift Imari, do you have anything to say concerning connection of blood group and genotype in relationship?
Well, the first thing I would say is that everyone should be aware of blood group and genotype, because you can't talk about um, preventing it when you do not know anything about it. Like
Sure.
when you are now aware that there is something like sickle cell, there's something like rhesus, you need to know your blood group, you need to take it seriously. Because if you are not aware, you are just leaving it to chance. And in those days when our parents were not well educated, enlightened, and informed as we are today, we attribute these things to spiritual attack. You see a woman after the first pregnancy, she keep losing her babies. You say it's a spiritual attack, somebody's eating the baby. Or you see a child who is always sick from childhood, always sick. Those sickle cell patients, they
Obanje.
are always sick. It does not happen the same way for all individuals. There are some individuals you see, there will be excess, there will be sickle cell patients, but they will live a somewhat fairly stable life. But there are some that their life will be so filled with crisis. And I had a colleague who told me about this child who has suffered crisis. Sickle cell, sickle cell, the condition of sickle cell comes with so many crises, and one of the most burdensome one is the pains they have. And this child has experienced this pain so much so that the child was so frustrated. The child was so, I don't know, the child even lost hope and was asking the doctor, Doctor, if I die, will this pain go away? Will it still be there? That's to tell you the deep sorrow and pain and whatever you want to describe it, what that child has been experiencing
So they go through a
since
lot of
birth.
emotional.
Yes, you see them, some look depressed, some will be socially withdrawn because they feel very different from their friends. They are always taking drugs, they are routine medications, they are always going to the hospital for one crisis or the other just to be managed. And so they just know they are different, they're not like their friends. So it affects their mental health too. And so we need to be very conscious about knowing our blood group, knowing our genotype, especially the genotype, so that you don't what people call today love and faith. Love and faith does not affect the genotype. Like it sounds, it is genetic. You are born with it and you will die with it. It's only through a miracle, which hardly rarely happens. People have tried it before, it doesn't happen. Now, it does not mean that if you are AS and your spouse is AS, it does not mean that all your children, or at least one, must be SS. There are persons who have gotten married,
Mhm.
AS and AS, and all their children AA.
Wow, miracle.
Yes, it happens because the chance is for each child during the inheritance is for each child. So it is very possible for you to be AS and for your wife to be AS and give birth to four children and they are all AA.
So it's not compulsory that there will be SS.
Yes, does not mean there must be SS.
And it's possible you have all SS.
SS.
So the
So you see,
possibility
the
is
possibility
there
is there for each
for every
pregnancy
pregnancy.
you have. And then the rhesus factors you talked about. If you take your antenatal seriously, like you attend in a tertiary center where you have specialists who will do the routine investigations and discover that you are rhesus negative, they're going to advise you when to take that anti-D because to prevent the formation of those antibodies. And so you know the basic thing is still knowing your blood. Just like in HIV sensitization, they will tell you know your status, know if you are HIV positive or negative. That's the first thing. That's what I have to add.
Okay. So we know that these young ones of nowadays, they can be so stubborn.
No,
They can
love,
be like,
love. They'll
Love
tell you
is a
it's
very
love.
major
Blind.
factor.
I feel like
Love
love is
cannot be
blind
blind.
during the
And you know what happens? Some will even tell you they will fast and pray. God can change it. I've
Mhm.
had a friend who had such faith that God can change it. Well, God can change it, but God will not see you put your hands into fire. And then it's when you have put your hands inside the fire, then you now make magic and then the fire will not burn you. Why not prevent yourself from being burned?
But what if the love is strong?
No, there is see. Then I was about saying that when you see your child suffering, I have a friend. He gave birth the first time, the second time. He was supposed to stop, but he said, let me just add the last one. And the first child was AS, the second child was AS. As he was about taking this last one that he was supposed to avoid initially, that became SS. And he has been spending money, spending time. Love will disappear at that point when you see your child suffering. You will even ask yourself, what did I even, some people will go to the essence, what did I even see in this girl or in this man that made me to stick to him like this when there are other better men? So when you see your child suffering, you have pity for those who are not your children. Not to talk of when is your child suffering, you're always in the hospital, you're always seeking for help.
But you know, during our parents' time, it was a lot easier for them to do this whole love thing and fall into the trouble. But
yes.
this is like Gen Z era,
The
and
woke generation.
the world has gone forward when it comes to technological advancement. People tend to know what to do once they discover, oh, we are ASAS. There are ways of boycotting this, having an SS child.
But some
So
of them are usually very expensive.
yeah,
How many
that's the
persons
that's
can
the
afford it?
drawback. That's the drawback. It's
Can
very
a common
expensive.
man afford that?
Even in Nigeria, I think there are some
Yes, they
highly
still do it.
specialized laboratories that can do the in
Yes, but
vitro
but
testing.
even when you tell them, can they afford
Now
it?
that's the problem. It's very
Can they
expensive,
afford it?
so most times people can't afford it. I know I had a patient once. The boy is about 9 years of age now. Both parents are AS. They had the child in Australia after a series of pregnancies, genetic testing, and all of that. Finally came to this one, got this one that is AA, and they kept the pregnancy. But of course, both parents are doing very well. They are financially buoyant,
Which is rare.
which is actually rare in this part of the world. And actually, Nigeria has a very high burden of sickle cell anemia in the world, like a very high burden. And we are also part of the economically
You know, we all
low
know our
country.
place. We know our place. You don't need to tell us our place.
We are so
We know
poor
even
that
to
we
buy
can't.
drugs,
Yes, it's a problem.
even to pay for investigations
You-
is very difficult. So we know our
And
place.
medical care is also out
That
of
is why
pocket, so we can't even
we
sustain
we
it.
think that prevention
Is better than cure.
Okay, so this sickle cell patient, like the children that go through sickles that has this SS as their blood group, right?
genotype.
Genotype. Okay. So can you like give us a detailed information of how they what they pass through, like the emotional trauma they go through? Like I know you're not in the show, you've not been in their shoes, but as a medical
Exactly.
practitioner, you might
Exactly.
have this conversation with them one on one to know how they feel.
I think the perspective of everyone involved in their care would be different. As a healthcare practitioner, my perspective, what I see will be different. What their parents see will be different, and they themselves going through the condition would have a different view, a different story to tell. And the best person to tell this story is actually the one suffering from the condition. I can only empathize with them. I can only understand to an extent what they tell me or how they present themselves to me. But I can't tell what is going on deep within. And the emotional part is one part you cannot take away when it comes to medical care. If the person is not happy inside, no matter the amount of drugs you give, it doesn't bring in the happiness that would help boost healing or recovery. In this case, suffice to mention that sickle cell anemia is incurable. It is who you are. It is who you are. So no, it doesn't cure. It's you. We just give them drugs to manage, yes, their condition better for them to an extent, so that they can integrate in the society and they can live close to a normal life like every other person. However, it is who they are. Now, what we see them go through is beyond what lips can tell. They go through pain. That's the general word to describe all they go through. They go through physical pain when they have their bone pain crisis. It's not paracetamol, oh. It's not Panadol. You can go as far as giving them morphine. You're giving them tramadol to suppress this pain because it's very severe. For those of us who aren't sickle cell anemia or living with sickle cell anemia, when we say, okay, this pain on a scale of 1 to 10, for us it can be like 4. For them, the pain they may be going through can be like 100 over 10. It's crazy. So they go through a lot of physical pain. They go through a lot of emotional pain. Sometimes they're angry with their parents for even getting married to each other. You both knew and you still went ahead to get married to each other. So they're angry. They live a life of bitterness sometimes when they don't have good support, mostly. They live a life of bitterness. And then the fact that they can't even go to school like their mates is a problem. You see a very smart kid is missing school every day. By the time you miss 3 weeks out of 12 weeks of a term, what do you want to do in during exam? Like you've missed a good chunk of your stay in school. That's about a quarter. It's a lot. You see them now struggling academically, trying to catch up with their mates. They repeat classes. Sometimes they can even be in year one whilst their mates are doing their PhD. That's how bad it can be for them. So the pain, the agony is so much that they are unable to speak or tell exactly how it is, but it's a lot. So what we see is just the physical one, the one they show us. They are crying, and what can we do? Sometimes you just have to leave them, give them water to drink, tell them, give them fluids, the little thing you can do for them, but they're going through a lot. So it's a very agonizing experience that even as a medical practitioner, I don't always want to see that. But they keep coming. We're in Nigeria, we're in Africa. You don't want you when you say, oh, this person is a sickle cell patient. Oh my God, it's a problem. Even when they grow up and become of age, they are women. Once they get pregnant, you know that this is a high risk pregnancy. This woman is not like every other woman. No, you're not going to do Hebrew woman here for her. You will pay special attention to her. And the fact that their blood level, that's their hemoglobin level or pack cell volume, is usually lower than the normal patient. You have to be very careful with them. You have to be very particular about them. You give them very special treatment. So their need is so much. Their need is so much, which is not like every other person. For the parents, it's not even what they live their life in agony. They regret the decisions they've made most of the times, like getting married to each other or even having children. So the agony for everybody involved in their care is great, and it's not what anybody wants to experience or wants to see.
So, is there a possibility that a sickle cell patient will be much healthier?
Yes, like we mentioned before, the severity for each of them is not the same.
Hmm.
Each individual differs from for each individual. I think I mentioned that some of them live a fairly stable life,
Yeah.
but while some will live a life filled with crisis. You understand? I've had somebody who I had to look at her eyes and saw the color of her eyes and asked her, "Are you sickle cell? Are you a sickle cell patient?" And she said yes. Just the color of her eyes. Yes. But yeah, but she each time I see this girl, she's always stable. She's always okay. She looks okay. She um she doesn't look like a typical sickle cell patient. She looks healthier, yes. She looks healthier. So it's not the same for all of them. It's not the same for all of them. They vary depending on, and they are what we didn't mention. They are precipitants to this crisis.
Yes, yes, yes.
But there are things that
No
provoke
trigger.
this crisis. That's what I'm trying to say. So someone who is prone to having these triggers will suffer more crisis than someone who is living more stable. Infections,
Extremes of
low
temperature.
extreme of temperature, low oxygen, and those who stay in high altitudes, who do not have enough oxygen, and they undergo what we call acidosis, accumulation of carbon dioxide in the body. So all these things, I know infection is a very common thing. It's easy for people to have infections. So someone who experience more of this, who have more of these triggers, will tend to have a more crisis-filled life, unlike someone who will be more stable with little exposures to this. So it's not the same for all. It's possible for them to live a stable life, very possible. They have to be adherent to their routine medications. Like I also asked that girl, "Are you on any medications?" Say yes, takes it daily. Yes, so if you take your medications, that reduces the chances for you to go into crisis and live a stable life. It all boils down to being informed, being informed about your condition. Like she said, it's not what you go to the hospital and they will cure. You have to manage it for the rest of your life. And of course, you can live from it.
Also, to add to that, there are those with the SC genotype
Yes.
and the SS. SS tends to be a lot more severe than SC. SC patients may live a fairly stable life, while the SS, you see them running in and out of the hospital every now and then. So that sometimes is a factor, but it's not a guarantee that if you're SC, you would be fine, you would not have crisis. No, that's not. Um, Individuals differ.
So you're trying to say that AA should not, AA can marry AS and SS, but
Yes,
SS shouldn't get involved with
when
AS.
there are S,
Okay.
when
Shouldn't.
miss,
When there's
the
S.
man has an S, the woman has an
Yes.
S,
Okay.
it's best you avoid it.
Okay.
It's best you avoid it. However, if your father is Otedola, you're wealthy. That's just what I mean.
Okay.
You can attempt it. You can attempt. You
Okay.
can attempt.
And of course, you won't see sometimes you might see somebody suffering and you cannot feel the extent
Mm,
until you are in the person's shoes.
exactly.
Then you understand. So we did mention that when you have just one, the S is called trait.
Mm.
So once you have the traits, once you have an S, try to avoid people with the same traits. Yeah.
So as an AA person, we are covered.
No, AA, you can get married to
To
anyone.
anybody, even an SS,
You
you're
can
good.
get married.
You're
Yes.
good.
You can
But
complement
the
the SS.
carriers, that's the AS, is best advised. And suffice to mention that aside the whole genotype, in vitro genotype testing, they can decide, okay, we'll get married, but we're not going to have any children of our
Well,
own, so we're going to
adopt.
adopt.
I don't know why people see
Oh,
adoption as. For me, I don't see anything for.
it's fine.
I don't see anything
It's
wrong
an
with
option. If
adoption.
you must
Yes,
have kids, you can adopt.
yes. What about
Surrogacy
those who
with
are not fertile? What about those who cannot
exactly.
give birth at all? It's just the way the society sees it today.
Mm.
They say this one
Everyone
no.
would love to
They,
give
in fact,
birth.
your mother will tell you say this one not be my blood. Your father
Hmm.
will tell you it's not our blood.
I
It's
want to go
somebody's
through the
blood.
But they
pregnancy.
say giving birth like to your own child, there's this pride, this
Yes,
prestige that
there is
comes
a
with
bonding
it. Yes.
that comes with it. Yes, there's a bonding, there's a pride, there's a sense of hope.
Yes.
This is my child. Well, in advanced society, it's not an issue.
Actually, we can actually
Personally, as
develop
an
the bond
individual, it's not
ourselves.
an issue.
You
You
can
can bond.
decide to.
Do you know that any child, these people that do what they call this, um, the paternity tests,
Yeah,
yes, that to know if it's your child or not.
DNA.
DNA testing. Thank you. A child you stayed with from birth and you grow up with that child and train that child is your child.
Mm-hmm.
The person might not be your biological child, but that person is your child. You understand? So your child does it is not necessarily that you must produce that individual. Anyone you just like having a father, anyone who has taken care of you from when you are not even conscious of anything to when you became conscious and you are now grown up, that person is your father.
So I'll start with you, Mr. Gift. What's your final words to those people that are stubborn, that feel like love is everything? With love, they can conquer all the challenges. So what's your advice to them?
My advice to them is that when the crisis comes, love will disappear. So be more conscious and be more take informed decisions. Don't take decisions out of emotions because they will all disappear. Emotions is something that can change. Emotion is not a stagnant thing. It's not a
Very dynamic.
it's
It's
dynamic.
changing every time.
It can change. Somebody you love today, you can hate, as in you can have deep
So much
hatred
hatred for the person
for the
tomorrow.
person. Yeah, it happens. People lose interest in marriages, lose interest in relationships for different reasons. And it's in the time of crisis,
Yes.
an enduring love. So just avoid it. There are the 1001 persons you can love. It's just that you've just decided to close your mind. What if the person dies? Can't you fall in love again? So love should not lead you. Emotions should not lead you into making wrong decisions. Think about your children. Think about the happiness. Think about them.
So, what's your final words to those who are already married?
Okay, to those who are married already, you just have to be patient, be strong, and then you should join in the advocacy.
Mm-hmm.
You should join in advocacy so that when you tell people about your experiences as a parent of a sickle cell patient, I think people will be more cautious. So you just have to be patient. You just have to endure. That's even the better word. You just have to endure, encourage your child. Most of the children, many of them are intelligent. They do very well. They are usually smart. So if they have a good support system, they can still do well in society. So you just have to support your children as a parent and then advocate to younger ones coming up. My mom has told me, she told all of us. So that's it. Nothing else.
Okay, thank you very much. So, Miss Beverly, what can you say, or what will you advise, or your final words as well to those sickle cell patients?
Okay, to all those living with sickle cell anemia, you all are warriors, and I just want to reassure you that you have the support of everybody, even though those who are not knowledgeable about the condition may stigmatize. I just, you all need to be reassured that you are loved. You can achieve whatever height you choose to get to in life. You can live your normal lives. It's just your cells that is sickle, not you. You can get to whatever height you want to get to with the right support. And I believe there should also be a voice. They should raise their voice um, to educate people, enlighten people, so that we don't have more people falling into this trap of having sickle cell children. Also, their parents should give as much support as they can. It's not a pleasant experience. However, the best you can do is manage the situation, support your children, and as much as possible, discourage those who are likely getting into that problem from going that way. And for those who are praying now, I am sure right now there are people in the church praying,
Fasting.
fasting, kabashing. There is no amount of kabashing you will do that will change it. So the best thing to do is to avoid it entirely. So those people that are praying, I know we've had a woman in the hospital, pregnant, AS, husband AS, and we're like, Madam, do you know what you're getting yourself into? She said, the Lord will take care of it. No problem. Jesus will take care of it,
He
but
takes care of everything.
he takes care of everything, of course. But he does not like presumption. He doesn't like us doing that. There's faith and there's presumption, so take it away. God would not want you to suffer. It's not his desire for his children to suffer, and that's why this information is coming to us now. Know your genotype, know your blood group, do what you ought to do to help yourself and your children, and
Voice of
avoid suffering, because who does not like a soft life? Who loves suffering? Nobody. So we can avoid this suffering.
and they tend to be burdened. I have a friend who he calls people for support.
Yes,
So it's not just a burden to yourself. It's
to
also
the
a burden to the
society.
society. Your
Everyone
community.
around you suffers because of that.
So for the sake of others too.
Yes.
Thank you very much for coming once again, Miss
Okay.
Beverly and Mr. Gifts. I've learned a lot, at least a detailed information about blood group and genotype. Thank you for coming once again. So, guys, we've come to the end of today's episode. Don't forget, you should look beyond love when going into a relationship. There are other things that matters too, especially your blood group, knowing your blood group and genotype. Don't forget, you can also share your experiences on our comment section, and don't forget to follow us on our social media platform on YouTube, Facebook, and Instagram at the Bliss R. I remain your humble host, Bliss. Bye, guys.